Talk a little bit more about the tailbone. So here's your tailbone or your coccyx that attaches to this bone called the sacrum. Know that a ton of pelvic floor muscles come and attach on the tailbone itself. What is one of the most common dysfunctions we see of the tailbone? It's called a hyperflexed coccyx. This can easily happen with a fall. And even when pain disappears after you fall on your tailbone or your hip or your low back, the problem is the bone can stay in this hyperflex position. And what this does is it's going to shorten the distance that the pelvic floor muscles travel from the front, from the pubic bone, as they wrap around the vaginal and rectal openings and attach onto the tailbone. So that's going to increase your pelvic floor muscle spasm. The next problem is, think about what we do daily when we need to defecate, okay? This bone actually, every time we poop, needs to be pulled back out of the way. The same thing needs to happen when we deliver a baby. The whole sacrum and the coccyx need to extend back out of the way. So let's go back to defecation and pooping, because this is an underlying problem that feeds into what's called outlet constipation. When the bone stays flexed like this, it's literally going to restrict us from having an effective bowel movement. There is a direct barrier that stays right there. So what patients will commonly do is they either strain, push, to move past that flexed position of the bone, or they figure out a way to take this bone, the sacrum, and extend it back, allowing the tailbone to move